Papa, Papa, come quick. We need to call Mom. Bowman, my forage horse, had a lot of snot coming out of his nose and mouth, and he was coughing really bad. Something was wrong, but what? Good morning, honorable judges, Madame Chairperson, fellow forage members, parents, leaders, and guests. I was scared. Papa called my mom, who in turn called our vet, who unfortunately happened to be on her way out to another call. Thankfully, she was able to put off that call and speed out to our place after hearing it was my $1 million forage horse. What was happening is that Bowman was choking. This is a very serious condition when it happens in horses, as they cannot regurgitate their food. Choke occurs when food gets stuck somewhere between the mouth and stomach within the esophagus. In horses, the esophagus runs down the left side of the neck. The horses that are choking are usually in distress, and care should be taken to help them as soon as possible. It most commonly occurs in horses consuming pelleted feeds, although it can also happen in horses consuming hay, bee pulp, and large horse treats. Horses continually produce saliva, which can cause feeds to expand and block the esophagus. Abnormal chewing due to dental disorders or irregular teeth floating, as well as bolting feed, eating large bites too fast, can cause the horse to have a larger than normal food quantity in the esophagus at one time. In addition, horses that eat too soon after being sedated may not be allowed to swallow properly. In Bowman's situation, it was dry bee pulp. Bowman can be hard to catch most of the time. My papa was helping me catch him. My papa grabbed a bucket and put some crumbles in a pail. He didn't realize it was bee pulp. Bowman was in a smaller paddock that afternoon that didn't have access to water, as we needed to catch him after school to head out to 4-H riding. Bowman came for the pail of treats. No one realized what was about to happen. As the vet was on her way to our place, she was telling my mom we needed to massage Bowman's neck and esophagus, since the esophagus is located on the left side of the neck. This is the area we needed to concentrate on. It would need to be massaged for at least an hour straight. So between my papa, me, and my mom, we started working on him. We could see and feel the lump of bee pulp in his esophagus, and we had to work carefully so we didn't damage anything while trying to dislodge the obstruction. When the vet arrived, she sedated Bowman with Banamine to decrease the spasms in his esophagus and to encourage Bowman to relax and put his head down. Sedation may allow the horse to pass the obstruction on its own. The vet said she would continue. The vet left, and she said we had to continue massaging Bowman's neck. The vet said she would return after the call she was first headed out to was complete. When she returned later that night, she decided to tube him with warm water to help clear out the obstruction. If it was still there, the warm water helps to break it down. Thankfully, the bowl of swollen bee pulp had passed. The vet said Bowman would be fine. He just could not have anything to eat, and we had to keep our eyes on him for the next 24 hours. So between my mom and papa, they took turns checking on him every hour through the night. Further treatment usually includes anti-inflammatories like Banamine and antibiotics for the potential of the pneumonia that may set in. It was so unbelievably terrifying. I've never dealt with a choking horse, and it was so scary. The vet said in most cases they passed it eventually without help, but sometimes, especially if it takes too long to resolve, it can result in damage and increase the likelihood of it happening again. Should Bowman or another horse ever choke in the future, which I hope never happens again, I will think back to this time. I will know what signs to look for, and I'll be able to help them quicker before the vet gets to us. This occurrence was definitely snot funny.